We're here because we are very interested in filling in the gaps in Medicare coverage. Those gaps include dental, vision, hearing, and long-term care. But we've taken particular interest in the lack of dental coverage based upon our many years of serving clients individually, and particularly those who need medically necessary dental care because of their underlying medical conditions. People who have lost their teeth due to chemotherapy and need treatment, people who need treatment before an organ transplant. And for many years, we have asserted that Medicare can and should cover such medically necessary dental care now, and that the Medicare statute only precludes routine dental services. As part of that effort to try to assert for medically necessary dental coverage, we also believe that that prohibition on routine dental services should be removed from the statute. We would like to see both happen. I'm pleasantly surprised by the interest and enthusiasm amongst a cross-section of different stakeholders to add a dental benefit to the Medicare program. It had been my long-term assumption that many people in the dental community were opposed to getting involved with Medicare for various reasons. But I'm pleasantly surprised that that tide seems to be turning and that there has been a lot of work done to try to show that, as has been a common theme, the mouth is part of the body, and that preventive oral health services can lead to other cost savings. When people who need medically necessary dental care because of their underlying health condition, for example, they need an organ transplant or they need the underlying dental work, if they can't afford it and the services aren't donated somehow, then the person goes without that coverage, which obviously can have severe and profound consequences for their health. Putting aside the need for preventive dental services in Medicare, the lack of medically necessary dental services in some of these particularly extreme situations, such as the need for dental services prior to an organ transplant, or the need for treatment following chemotherapy, can lead to severe health consequences and even death. When looking at different healthcare legislation, it's ideal to be able to identify things that would offset any costs. And the more evidence that can be developed in that area, the better. But I don't think that should serve as an overall limitation on pushing for a dental benefit. And where there's a will, there's a way. And if policymakers and if the public are better educated about the need for oral health care and the lack of coverage in Medicare, that will go a long way towards addressing whatever the overall costs of the legislation might be, which would be assisted by further developments as far as offsets.